What are some of the top natural remedies people can use to prevent or reverse things like plaque, cavities, and gingivitis, Dr. Mark?
So I think it all depends on what your definition of natural is. Picking up a toothbrush with nylon bristles, plastic handle, a toothpaste that probably likely has ingredients in it that are not good for you, that's not where I'm going to go. I mean, obviously oral hygiene is very, very important. And given our current state of being in terms of diet, the Western diet, you do need to do all those things. But obviously the first thing I would look at would be diet. I mean, what is the root cause of all the issues in oral health? And that is our diet. If you eat well, you really don't need to pick up that nylon toothbrush. You don't need to use a floss with microplastics in it. You don't need to use a mouthwash. You wouldn't even be concerned about it. You wouldn't have bad breath. The next thing would be, if you're mouth breathing a lot, you're going to have a lot of dysbiosis of the oral microbiome. What does that mean? It means that you're going to be very sick in your mouth. You're going to have a high rate of decay, high plaque levels, as you mentioned. High plaque levels means a thick, very dysfunctional layer of plaque. Now, plaque is not bad. Dentists always say remove it completely, then you've done a good job. The biofilm, which is what I'm going to call it from now on, it's not plaque, it's a biofilm. It's there for a reason. That's where the oral microbiome does all its magic. But it does thicken and become very, very dysfunctional. It doesn't do what it's supposed to do if you're mouth breathing a lot. Even if you're talking a lot. Let's say you're in a very dry environment and you're doing a lot of talking. That's going to dry you out. Let's say you're running a marathon and you're at your, metabolic limit in terms of cardiovascular output, and your mouth's going to open, and you're pulling in a lot of dry air, unless you're running in a very humid environment. So if you're going to run a marathon, do it in Hawaii.
Yeah, or Miami.
Or Miami, that's right. I would rather do it in Miami. It's flat, right?
That's true.
So that's another thing that gets overlooked. Diet is the big one, and the snacking, and also the frequency of snacking. There are things and supplements that you can do, that you can take. Again, is that natural? Is a supplement natural? I always think of it as something that it's a necessary evil because of our epigenetic kind of state.
I guess if it comes from a whole food source, we could call it natural versus synthetic.
True. Absolutely. And of course, whole foods, it would be better if you could get the whole food.
Yeah.
But, we live a different life than our ancestors do. We're up all night, we're running around, we're sitting in a car, we sit at work, we're not chopping wood and throwing spears, right? So I think it's diet and dry mouth. That would take care of 80 or 90% of it. Now you could add minerals. We live in a mineral deficient world. We could go on and on why that is, but it really is. And when I say that, people are like, really? Come on, there are minerals everywhere. No, if you look at the research, look at our agricultural practices, if you look at what is, even in our vegetables, in our lettuce, there's supposed to be a lot of minerals there, a lot of magnesium and calcium and even boron and selenium. Those things are missing from our environment. There's lots of research out there. So minerals are a big deal in oral health because saliva is basically a storage chamber. It's a reservoir of minerals. That's its main job because the teeth need minerals. We need minerals for cellular processes. Every cell needs a mineral to function, to get things passed in and out the cell wall, in and out of the cell. That transportation wouldn't happen without minerals. That's why magnesium is so important in dental health as well as overall health. So supplementing is important. One of my favorite supplements, which very few people have heard of, it's a longevity supplement. It's called spermidine. It was discovered in male sperm back in, I think, the 1800s. That's where they first found it.
Hence the name.
Right? I use a product called Primidine. I have nothing to do with them. It's just they have a good pure product. It's out of England. That's a great supplement for gum disease and for inflammation because it induces autophagy in the mouth. That's what you want, especially when your tissue is dying off and necrosing, and that's the side effect or the after effect of chronic gum disease, inflammation in the mouth. And that's when you get gum disease. That's when you start looking kind of long in the tooth and sensitive teeth and decay on the roots, even yellowing of the teeth. So there are supplements. Vitamin C, of course, is important. Vitamin K2 is the big one. If you can get vitamin K2, however you can, I would supplement with it. And there's only one supplement that I like. Again, it's a company I've never spoken to. They have the right ratio of MK4 to MK7. Those are the two. There's a water-soluble and a fat-soluble version. There's several others that don't seem to be that important, but those two need to be taken often, twice a day for the water-soluble, obviously. Most vitamin K2 supplements don't deliver it that way, which is very sad. You can get it in food, but it's very difficult, as for obvious reasons.
Sheep and goat dairy, cow dairy.
Totally. Natto, fermented beans. A lot of people won't even touch that stuff. It's a pretty wild tasting food. I would recommend you try it though. I mean, it's not bad. Again, being kind of keto at times, I always stay away from beans. I never eat beans, but
Same.
fermented natto, it's not too bad. I would recommend it, but you can supplement with it.
Yeah.
But K2 is huge. So K2, D, and A, D3 and A. D3, obviously, it's all about bone health, but a lot of those three vitamins, one's a hormone, those three supplements really help oral health in so many different ways, indirect and directly. Bone health, but also how your teeth form and the hardness and the structure of your enamel.
So fat-soluble vitamins are important here, minerals, magnesium.
Yep.
You said that if we just fixed our nutrition, our diet, and we get away from mouth breathing and do more nostril breathing, it would solve about 80% of our dental issues?
Dental issues, yeah, that's it.
That's a bold statement.
It is, but it's true. I mean, I know this because I've been in practice for 40 years. My keto patients never present with gum disease. My paleo patients never do. They're just not eating the foods that cause this problem. They don't have decay. I actually send them off. I don't have them come in every 6 months. They have less tartar, so their plaque formation's different. Tartar is a calcified version of the biofilm, of that thickening carpet that covers your teeth that is not functioning well. No bleeding points, no inflammation in the mouth, pleasant smelling breath. If they were eating that way as a child, they have great facial development, great jawline, open airways, no bags under their eyes. I mean, there's so many different signs. Dentists can recognize sleep apnea decades before a physician can, because we're looking at different things.
Yeah.
And, I go around all day long, and I know there are a lot of my colleagues that do the same thing. In fact, when we're together at like a party, we're just not a fun group because we're pointing out everyone that has sleep apnea. It's within seconds.
So you're looking for bags underneath their eyes.
Narrow face, jaw profiles, positioning of the teeth, tongue tie.
Yeah.
These are things you can notice from a conversational distance or interaction. So early detection is key. That's why I would tell you go see a functional dentist as soon as you can, like at 1 week old. If you can, have your mom or dad bring you in.
That would have been amazing. That would be amazing. That would be like the ideal situation if your mom, as a child, brought you to a functional dentist.
Right, yeah.
So with diet,
yes,
most people are eating sugar. We're eating processed junk food, seed oils.
Right.
What is sugar doing to our dental health? You mentioned that getting your diet in check and eating more clean, like keto, is going to help. But what is sugar doing to our teeth?
Right. Directly.
Yeah.
There are certainly, we've been talking mostly about indirect effects. So direct, and this is the most common thing that your dentist will tell you. They will tell you that if you eat candy, the bacteria consume that fermentable carbohydrate, very processed, pure sugar, glucose, sucrose, fructose is the bad one. Those bacteria are optimized. In other words, they grow quicker. They become very opportunistic. They push out the other bacteria that are trying to modulate all this. I can give you specific names of bacteria if you want.
Yeah, give them.
Like the 𝙎𝙬𝘽𝙎𝘾 bug is when that becomes prevalent, it becomes the bully. In other words, if there are more numbers of them in this community of bugs in the mouth, it pushes out all the other bugs that are trying to keep the pH of the saliva more neutral. 𝙎𝑚utans goes nuts. It consumes this candy and it produces a lot of acidic fluids. It's the excrement of its metabolic process of consuming these processed foods. Now, it's not just sugar. I love to pick on crackers, and a lot of people think that's a little dramatic, but it's probably worse than candy, like a saltine cracker, a goldfish cracker. I mean, think about it. That is just a perfect processed, mulched down, then later enriched, broken down. It's exactly what the bacteria can consume at a much greater rate. And that's what creates more acid. So these foods will harm the teeth by allowing the pH in the mouth to drop to a point, and we call this the critical pH. And there are different pHs for dentin, which is the root structure of the tooth. That's softer, that has less calcium in it or less hydroxyapatite in it than enamel does. But at some point, there's a pH. It's around 5.8 to a little lower than that, depending on which part of the tooth we're talking about. When things drop, when the pH drops below that level, calcium is just fleeing from the tooth. It's being leached out. It's being dissolved out.
Wow.
And that's what it happened. Now, that happens after every meal. It can happen a lot if you're eating poorly, or it can happen not at all, which is very unusual these days. You'd have to be eating on a raw carrot, for that not to happen. How often does that happen? We're always dipping it into something. And that's why the keto diet or a paleo diet is so good. We're eating a lot of animal fats and animal products, whole foods. We're staying away from the sugars and the processed foods. If it comes in a bag, you're looking at cavities. Seriously.
It makes sense. So when you're doing a keto diet or a carnivore diet, you're eating whole foods. You said earlier that you don't have to brush your teeth as often or floss as much.
Right. Because
you're not eating this processed junk that's inflaming your gums or creating this bacteria to flourish. So you could actually get away with less brushing and flossing.
There are people all over the planet. I have patients. The spouse would come in, the partner would come in and say, my husband, or it could be my wife, never flosses. And then they would say, oh, it's genetic. And no, it's diet. Typically, one partner will eat better than the other. And you see that all the time. So you really, as a dentist, you need to get a good history. To make these observations and over decades of clinical work, you need to know exactly what your patients are doing at home. And that sometimes means having them write a diary, because they're clueless too. They may not be on a diet for a specific reason. And I want to know what they're eating. I want to know if their mouth's open at night. I want to know what they're snacking on, how often they're eating. Frequency is a big deal in dentistry. The more times you get that lowering of the pH levels, we call it an acid attack, the more likely the tooth cannot catch up with fixing itself. The tooth can only fix itself, remineralize, pull all those minerals in saliva, like I mentioned earlier, out of the saliva and onto the tooth and fix it if it's always demineralizing and if the pH is very low. And that can only happen above the critical pH, let's say above a pH of 6, near neutral. So that's why it's important not to brush your teeth after a starchy meal, because you're literally scraping more enamel away. You're helping the demineralization.
Oh, wow.
Event, right. So swishing with water, stabilizing that pH as quickly as you can. Chewing xylitol gum would help. There are lots of studies on how xylitol gum can stabilize pH and help with remineralization, and it's easy to do.
Yeah.
Sending a kid to school with a toothbrush, that's not going to work. They're going to be laughed at. The poor kid's going to go to the bathroom, pull out the toothpaste and the toothbrush. Send them to school with xylitol gum. Two pieces. Easy. And they love it. And they get to chew gum.
I do the drops, the little xylitol drops as well. Yeah.
Absolutely perfect. Yeah, that works as well too. You can swish with it. It's a form of oil pulling in a way. Foods affect demineralization of teeth directly based on how processed they are. If they're really processed and broken down, the bacteria can consume more of it in a shorter period of time. So
another reason to avoid processed food, not to mention it'll make you inflamed and gain weight and all the other problems that occur.
Well, and then if you're not eating well on the other side, there are systemic effects that indirectly inflammation, and that will help your teeth degrade quicker. And then the gums around the teeth start degrading, and it becomes just this massive inflammatory cytokine response, and it becomes uncontrollable, even to a dentist or a hygienist.
What you said not to brush your teeth after a starchy meal. Mm-hmm. What if it's a carnivore meal, protein and fat?
Don't worry about it. You can brush if you want.
You can do it. It doesn't have that issue.
That's the thing.
Yeah,
and
you don't need to as much.
You really don't need to brush, and you'll feel it. I don't know when the last starchy meal you had, but we're here in Miami, my daughter and I, and we're enjoying it. And I was at a great restaurant last night that made their own sourdough bread, and I had the bread, and I had 2 pieces of bread, and I can feel. I don't eat it that often, so I can feel the effects, and not only systemically, but also on my teeth. You can feel that thickness on your teeth. I mean, as you run your tongue over the teeth, it should feel pretty smooth. There is a biofilm, but if it starts feeling kind of furry or thick, I mean, there are lots of adjectives that would apply, but that's a sign that those bacteria have proliferated. They've grown, and the ones that you don't want. So, and then you can sometimes taste an acid attack. You can see the acid attack in some ways. You can smell it. Some dentists can smell it. You can smell infections in the mouth. That's basically halitosis, bad breath. But
would rinsing with baking soda help with that?
Well, rinsing with baking soda, there's nothing wrong with baking soda. Rinsing it, brushing with it, it's not abrasive like the internet supports, and everyone else thinks even dentists thinks that it is abrasive. It is not. It has an RDA of, I think, 5. It's less than all the toothpaste on the market.
Is it usually conventional dentists that believe that, or even some functional?
I don't know, but every time I say that, use baking soda as a toothpaste,
they're
like, oh no, my God, you're going to abrade your teeth. And no, the toothbrush is going to abrade the teeth more than the baking soda. But swishing with it, brushing with it will stabilize the pH very quickly in your mouth.
Okay.
But swishing with water, like a Pellegrino, a neutral, or a alkaline water would do the same thing.
Okay.
But baking soda will do it in a hurry. There's some concern baking soda can bind certain materials. I wouldn't worry too much about it, but I think just swishing with water after a paleo meal, you could go all day long doing that.
That's your best bet.
Oh, absolutely.
Just drink some sparkling water.
No problem.
Now with mouth breathing, what's the mechanism there? I know there's a relationship with nitric oxide, but why is it so bad to breathe through your mouth versus your nostrils?
Right. So mouth breathing has many different aspects in terms of overall health, but also dental health. Let me start with the dental health. So if you mouth breathe a lot, your mouth dries out. Saliva flow, not saliva flow, the flow remains the same during the day, during waking hours. But you start drying out your mouth and you have less saliva. And that saliva, you need a certain amount of flow and amount of saliva, volume of saliva in the mouth to stabilize the pH. So it's kind of like a container. If the less water you have in a container, and you have acid in that same container, then the acid becomes stronger. You want to dilute the acid. So, for example, mouth breathing at night, running a marathon, sitting all day long. A lot of kids do this. They're reading, they're at school, they're watching TV, their mouth is open. They're not talking, but their mouth is open. Certainly sleeping with your mouth open is actually worse because saliva flow at night drops off. Again, your body says, we don't need a lot of saliva. Your mouth is hopefully closed. We're going to shut that system down temporarily. But think of all that dryness and the pH starts lowering. It starts dropping into the acidic zone. Your remineralization events will be less likely to happen. So just the dry air coming in is a problem in itself. Now, there's a whole nother aspect to this, and it ties into sleep, sleep dental medicine, but breathing through your nose, in a nutshell, breathing through your nose is optimal because it forces you to have the right ratio of CO2 and O2. So breathing is, and again, I'm not a pulmonologist, but breathing is very complex. We need CO2. In dental school, I was taught it was a poison, a toxin. Too much of it and you die. But it's necessary. Without CO2, we cannot get that hemoglobin, the red blood cell, to release oxygen to the muscles and to the brain. So you need a certain amount of CO2. You need, obviously, oxygen to attach to the red blood cell. And then you need a third gas, NO, and we'll talk about that later. It's actually a 3-gas system. But the CO2, if you breathe through your mouth, you can overbreathe CO2. And then you start hyperventilating. You're not releasing, your body is sensing that not enough oxygen is being released to the brain. It's the base of the brain. There are other parts that that are responsible for measuring your respiratory rate, but it's a very old part of the brain, and it's very subconscious, autonomic, and it senses that, and it ups your respiratory rate. Then your breathing becomes more shallow, and then you start expelling more CO2, and then you become anxious. You maybe some brain fog.
Yeah.
Obviously, you're affecting your teeth at the same time just by drying out your mouth. You need a certain amount of CO2, but if your mouth is closed, you're guaranteed not to be able to overbreathe CO2. You will not expel as much as you would with mouth breathing. So it's kind of a guaranteed state. If you just keep your mouth closed, you will have the right ratio for that period of time. And it's almost instantaneous. I mean, within seconds, you'll notice that difference.
I've seen some photos of children that are chronic mouth breathers versus children that are breathing through their nose, and their face looks completely different. How is it changing their facial structure?
Oh boy, how much time do we have?
Until tomorrow. You're flying back tomorrow.
Okay, good. I'll try and keep it simple. So I'm glad you noticed that. A lot of dentists don't notice that. They just think it's a individual phenotype or
Really?
just an individuality of the patient, and it's not. I mean, our species has a certain look. If you look at all the bodies we've dug up, the skeletons and the teeth are well preserved in all of those archaeological, anthropological digs. I mean, we're different than our ancestors. We look different. I know Mark Sisson talks a lot about this.
Yeah.
There's a dentist up in Chicago that does a great job of this. Can't remember his name. This is in the realm of dentistry, and this is where dentistry really needs to
catch up.
Not catch up, really pony up. I mean, they need to really start investing time and money in educating dentists on this. I got a little bit of it back in '83 in San Francisco in my dental school, and it was only because the oral surgeon that was teaching it, this was kind of his pet peeve. He was reading about all the looking at skulls. We actually had a skull museum in our dental school.
Interesting.
And I walked through there, and it looked very different from some of the skulls I was looking at in photos and what I was experiencing. So we would see the measurements from this tooth to this tooth on the upper second molars, and we would see that in the museum. And again, this wasn't mentioned other than in that one class, but it's not typically in the dental curriculum. And then we would measure later in my career, not in dental school. And then I would go, well, that's weird. It just must be a small person. No, it was a narrow person. It was a narrow jaw. So anyway, to answer your question, the question was, how does nose breathing, how does mouth breathing
change the facial structure?
Right,
yeah.
Exactly. Directly, it would be how the air flows and how the position of your tongue, the anatomical muscle action. It's the muscles that shape the face. So if you're breathing correctly, if you're swallowing correctly, it's not just breathing, it's swallowing. It's whether you were able to breastfeed properly, latch on properly. It's the strength and the action and the movement of these muscles that shape the lower face. The lower face is like soft clay, and it's growing. And you could change these things very quickly, within days sometimes, with devices. Even tongue depressors, having them bite, you can move teeth and bone. These were all kind of like circus tricks back in the old days in dentistry. It's like, you see that tooth, it's inverted? Well, we can move it in a matter of 5 minutes, and they would have the patient bite down on a tongue depressor, and it would move. It's not the tooth that's moving, it's the bone that's moving. That's how soft the bone is, or how malleable the bone is. So it's how the air goes in and out. Nose breathing forces the air to go in slower past the airway. The swallow reflex, the buccinator muscle. There are other muscles. There's even the position of the hyoid bone, this little bone that literally floats in the neck. All the positioning of that and how it develops and how it grows while you're mouth breathing or whether you're nose breathing, that shapes the face up until age 9, and then it pretty much shuts down.
Really?
Yeah. So you have that window, and a lot of parents, I very frustrated for them as well, and they are too. They hear about this. They hear about functional dentistry, orthotropic orthodontics, expansion, and treating at an earlier age, starting at age 1 or 2. And their child's 8, and they're like, why didn't someone tell me? And it's really sad. And I don't like saying this, but I think modern orthodontics is a scam.
Yeah.
I really do.
Messed me up.
Yeah.
I'll talk about it a little bit later.
Yeah.
But yeah,
I mean, why are we waiting until, when I was in dental school, there was we were just beginning to do the phase 1, phase 2, and it was this big revolution. We're going to treat a little earlier, like at age 9 or 10. It's still too late. But for a long time, it was just wait till all the teeth fall out, the baby teeth, and then we'll just deal with what's left. And by that time, the jaws are small, and the teeth are just haphazardly at different angles, and that has lots of ramifications as well. So, but we're learning, but it's not mainstream yet in dentistry. And the orthodontists really push back. They've got a great little system. I get lots of hate mail from orthodontists. I get a lot of love mail from orthodontists as well, wanting change, especially the younger ones. It's a very successful financial model. They're typically the wealthiest dentists, maybe other than oral surgeons, but oral surgeons work hard. The orthodontists, they need to change their model.
So one easy thing that we can do is consciously become aware when we're breathing through our mouth to switch it up, close your mouth, breathe through your nose throughout the day. Obviously, when you're talking, it's hard to do that.
Yes.
But when you're watching television or just being by yourself, you could breathe through your nose.
Right.
At night, I mouth tape. And that has trained my body to now use my nose versus my mouth, because I was a chronic mouth breather. I knew this by waking up. My mouth was completely dry. What are your thoughts of mouth taping before bed?
So I'm a big proponent of mouth tape. I mentioned it in my book, which is already 7 or 8 years old. It's become quite a TikTok phenomena and all that.
Yeah, you were way ahead of.
Well, it's gotten a little out of control. It is not a solution for full-on sleep apnea.
I agree.
Yeah, that was always clear. I used it in the beginning as a diagnostic device, and a very quick one. I had very little time with my patients. It could have been a discussion while I was doing a filling, and this patient had a lot of cavities because they were mouth breathing, and I wanted to know if they were actually mouth breathing. And I would ask them, and if you ask a average male, they say no. Women are like, well, tell me more about it, right? And then I would ask them, do you snore? And so I just stopped that because that wasn't getting me anywhere. I would send them home with mouth tape, and I would have them text me the next morning, and I would ask them to tell me, did the tape stay on? If yes, okay, they can nose breathe. Did the tape stay on, but you had a horrible night of sleep? If they said yes, it was okay, they can breathe through their nose, but not well enough, and they were suffering from a little hypoxia, and it was uncomfortable. And then most of the time it would be, because I would always pre-select these patients, I pretty much knew who would. I use this less for myself, but more for them. So if the tape comes off, I would explain to them, especially if it was a child, because they would not believe that their child was not nose breathing. If the tape keeps coming off, then obviously you cannot breathe through your nose, and that's a problem. And from that point on, you're going to be a different person unless you don't treat it. You're going to have a different life. You're going to interact differently with people. Your personal relationships will be different. You're not going to be as sharp as you could be because you're going to have brain fog. You're not going to be happy. You're going to suffer from anxiety, depression, even worse. You're going to have an oral dysbiosis, which can lead to psychiatric disorders. Psychiatric,
yeah.
Thank you. Disorders. I mean, these are big implications, and it's a problem. And you need to know if you're mouth taping or not, if you're mouth breathing or not.
Yeah.
And it's important. And unfortunately, it has a very bad connotation. The current generation doesn't know it, but my generation, if you were called a mouth breather, you were like a criminal or a crazy man.
Oh, I didn't know that.
But there's a little truth to that. It's an old wives' tale, right? Huh. There's always a little truth to a wives' tale. So they talked about mouth breathing. James Nestor, who wrote Breath, incredible book, incredible author. And he wrote about mouth taping. He interviewed me. I'm in the book, and I made some bold statements back then. In retrospect, they're not so bold because now everyone understands it. A lot of dentists now are talking about it and they see it. But back then it was a little bit of a stretch. And that was that mouth tape, mouth breathing, if you're mouth breathing, is the #1 cause for dental decay. It's not diet. It's not what brushing or not brushing. It's mouth breathing. And if you are mouth breathing, you are very likely 100% to have decay. That's how much of an impact it has. But mouth taping, again, back to that differential diagnosis, it allowed me to quickly demonstrate to the patient that this is an issue. And then they would start listening. They would agree that they have to get a sleep study, that they have to see an ENT. Now, if you're good at nose breathing, but you forget, and at night, I mean, I mouth tape every night. I've been mouth taping for 15 plus years. My wife and I mouth tape. If we don't mouth tape, our scores are not as good. Our respiratory rate goes up.
Same.
CO2, O2 mix changes. I mean, it's all there. It's all easily identifiable and measurable. When we go to high altitude, when we ski in the winter, we see the changes. Allergies certainly not being, I mean, this is not a fad. This is not a TikTok thing. And it's not as simple as mouth tape and your life will be better. But mouth taping for many people that are borderline will bring the nose back online. So let's say you have some allergies, you're used to mouth breathing, and your nose just doesn't get a lot of love, right? And what I mean by that is moist air, warm air going in and out, nasal biome. Again, if your nose is very dry, you're going to get a lot of sinusitis. You're going to get a histaminic response. The nasal passages will be narrower because they're inflamed. They thicken a little bit. You can undo all that by mouth taping. And if for 6, 7, 8 hours a night, you're breathing in and out through your nose, which will lower your respiratory rate, raise your HRV levels, it will make sleep, it'll produce fewer disturbances during sleep, less rolling over, you'll sleep deeper, more likelihood of deep and REM sleep. All of those things will happen if you're kind of a borderline case where if you can breathe through your nose, but you need that little push or that reminding. And I don't know why that is. Why does a obligate nose breather, why does their mouth fall open at night? I don't know. It could be because we're sleeping in mattresses. Maybe that's not how we were designed. Maybe we were sleeping in fetal positions on a straw bed somewhere. I don't know, in a cave between rocks. I don't know why that is. But how you sleep with your mouth open or closed is the easiest thing you can do, especially for your dental health. Mm-hmm. It'll lower your dental bill. It'll take away the likelihood of gum disease and bad breath and canker sores, decay, cavities, narrow arches, poor facial development. Make sure that nose is online. That's so important. And if you can't mouth tape, then there's a problem. I mean, that's the great thing about mouth tape. It costs $1 or $2 for a roll. It's cheap to know that. So,
hey, I want to just briefly interrupt the video you're watching to share something with you. One of my favorite companies that I use for health and longevity and biohacking is a company called BonCharge. And they have a whole range of incredible products, including the blue light blocking glasses you see me wear right now. But one of my favorite products from them is an infrared sauna blanket. Sauna blanket works by raising your heart rate to a workout or a training session. So you burn more calories while you're actually lying down and relaxing. Also, it's going to cause you to sweat. And one method of flushing out toxins from your body is through sweat. There's also one of my favorite benefits, this endorphin release. Every time I get out of the sauna blanket, I feel like I just got a 60-minute massage. So it's easy to set up. It's super convenient. Head over to boncharge.com/ketocamp. And if you use the coupon code KETOCAMP at checkout, you'll get 15% off your sauna blanket. And actually, any of their products are 15% off with that code. All right, let's get back to today's video. Do the breathe right strips work at all? The strips that you put on your nose that help open it up, does that work at all?
It does.
Okay.
So it's all about where the obstruction is or the constriction. There are times that I'll use it during allergy season. A lot of people, when they breathe in through the nose, it collapses. So it'll help that. It all depends on where the constriction is.
Okay.
The constriction in the airway can happen at the velopharynx, the nasopharynx. There are different zones. A good dentist will look for that before he prescribes the oral appliance, because the oral appliance only works when the constriction occurs at a higher level. So you really need to know where the narrowing, where does the collapse occur, or where does the narrowing occur, where the pressure builds up, the pneumatic pressure of the air.
Makes sense. Yeah, I want to get into.
It's all plumbing.
It is like plumbing. Yeah. What are some of the key signs? You mentioned a few things to pay attention to, but what are some other key signs that somebody has poor oral health that may lead to chronic disease, like crowding of the teeth? What are some other things that you're looking at as a dentist that show you this person has poor dental health?
Right. That's a good question. So I look at the color of the skin underneath the eyes. I look at bleeding gums. You can see bleeding gums. You can see the morphology of the tissue when they're smiling. Facial type, we talked about that. The facial profile, shape, speech patterns, tongue ties. Sometimes you can pick that up. Smell, you can pick up.
Their breath?
Yeah. I mean,
how do you know if somebody has a tongue tie just by speaking with them? Would you have them like put their tongue up, or would
well,
you know?
No. I would never do that to someone unless I really knew them. Yeah. No, you can tell by movement, by the buccinator, cheek muscles, lip posture is a big one. Also, when they swallow. So if I think I'm onto something, I'll make sure to watch them while they're drinking. You know, if you're at a party, they're drinking something or swallowing or chewing food and swallowing. Look at the swallow reflex, position of the hyoid bone, the arch here, size of the neck. Obviously, you can look at very indirect things like BMI, what they eat, all of those things, but that's more indirect. But as soon as you get in the mouth, I mean, there are a lot of things you can see. Bleeding points, morphology of the tissue, more of it, further back. You look at the Mallampati score, how low the soft palate hangs. You can actually see further back than that, size of the tongue, scalloping of the tongue. Sometimes that can be seen at a conversational distance. If you see some of their tongue come out if they're laughing, you'll see a little scalloping on the sides of the tongue. That means the arch is too narrow. The tongue is probably normal sized or too big for the space. Pronunciation of certain words. The position of the tongue, right behind the incisive papillae, right behind the upper front teeth. That's important. Can they do that? That's an important position. That's where your tongue should be resting when you're not doing anything. A lot of people can't do that due to a tongue tie or due to other reasons as well. And these are all things that physicians cannot notice and are related to sleep apnea. So there's a great organization out there called the aadsm.org. That's where I got all of my training, and that's where dentists and physicians come together, the researchers in both fields come together, and they discuss all this. There's a great subset or crossover of information there, and that's where I would recommend dentists get certified. It doesn't take long. And then they can recognize this. And it's also a great practice builder. And when you go home and sleep at night, you know you've done a great service. You've fixed a tooth, but you've also fixed a person.
Yeah.
And their whole destiny, their whole healthcare destiny and their lifespan and longevity as well.
With sleep apnea, what would you say? What would you estimate? Not the studies, but what do you think? Your hypothesis or guess of what percentage of Americans have variation of sleep apnea, whether it's severe or mild?
It's a great question. So one number that is pretty accurate is that of those people that have sleep apnea, 90% are undiagnosed. They're out there driving.
90%.
They're your surgeon. They're flying your plane. They are driving on a two-way street. They're picking your kids up from school. I mean, you name it. That's a frightening number.
Explain what sleep apnea is doing, because we didn't actually unpack exactly what sleep apnea is and why we understand it's problematic, but what is happening?
Yeah.
With sleep
So
apnea?
in a nutshell, sleep apnea is the inability to breathe properly, especially at night, to the point where you're not sleeping well. You're always awake.
So you're getting
coming out of
hypoxic
deep sleep.
cortisol response.
Immune deficiencies, brain fog, the lack of healing for the brain at night. The brain needs to fix itself every night. So does the liver. Toxins, antioxidants that you're not able to control, aging, premature aging, tone of the blood vessels, high blood pressure, heart arrhythmia, stiffening of the heart muscle, eventually cancers,
weight gain, insulin
ADHD,
resistance.
psychiatric disorders, all of that. It's a scary disease, and it's become more prevalent. A lot of physicians and dentists are saying we're just better at noticing it. I don't believe that for a second. We're still not good at
That's the same thing they say about autism as well.
Right, exactly. Yeah.
So it's a problem. 90% of people who have sleep apnea have no idea.
They may know it, but they're not officially diagnosed.
Yeah,
they're not getting treatment.
Yeah.
They're not getting treatment. So, but to answer your question, the numbers are all over the map. So there's a link between bruxism, sleep bruxism, which is grinding. It used to just be called tooth grinding or bruxism. But then when we found that there was a link between bruxing at night, we called it sleep bruxism because it is related to the position of the jaw and the tongue, the body wanting to grind. It's kind of a violent reaction to an apnea. An apnea is a moment where the airway is blocked. So you have a dry mouth. You've been mouth breathing. The whole oral pharynx is dried out. There's no mucus or saliva there. I mean, less than what should be. And as the airway collapses, especially when you go into deep sleep and REM, muscles relax, more than relax. I mean, they just become very loose. There's no innervation. which is a protective mechanism. Otherwise, we would be running in deep sleep. And So there's an ear muscle, there's the eye muscle, and there's the diaphragm that keeps working, right? The breathing muscles. Everything else is offline. But that means the airway muscles are offline too. And then they come together as you pull a lot of air through a squishy tube. And again, another advantage of nose breathing is that as it comes through the nose, the volume of air is the same, but it's slowed down, and there's less volume as it goes, so it's less. Right, that Bernoulli's effect is lessened. That's a big one, by the way. But anyway, so all the air is coming in and out because the patient's gasping for air, and then the airway closes. It gets pulled shut. It doesn't close. It gets pulled shut, and because it's so dry, it sticks closed. I mean, it's not viscous. It's not lubricated. And then you have to undo that. Well, your body wakes you up in a violent way. I mean, you start bruxing and swallowing and thrusting your jaw, and plus your brain is in panic mode, and you have this sympathetic tone. That can happen. I have patients that had an AHI, that's the measurement of apneas and hypneas, which is a different version of an apnea, of 60 to 120. I mean,
so 60 to 120 of those per hour? It's happening 60 to 120 times per hour?
Right. I mean,
so hundreds of times per night.
Yeah, right. Grizzly bear is coming into your room, scaring the living daylights out of you, right? So that's a problem, obviously. So you're going to wake up pretty pissed off and angry and afraid and anxious.
And this is more of a severe example.
Oh, this is a severe example.
Yeah, because there's more mild versions.
Well, let's use myself as an example. Okay. I discovered. And that's why I wrote my book, because I had no idea. I was healthy, I was thin, I was running around like a madman. I'd stay up till 1 a.m, get up at 5, go to work, mountaineer, ski, cling off glaciers, mountain bike and all that. But I would take naps. I was a little groggy. I'd get that second wind that I would ignore at 10 o'clock and go till 1, and I would snore at night. And my wife did too. So we dropped off Catherine, who you met, my oldest daughter, at college. And that was the first time we had all slept in the same room for a while, other than camping and all that, backpacking. And I literally woke up with my 3 daughters beating me with pillows.
Because you were snoring so much?
Because I was snoring so loud. So I'll keep the story very short, because this is the first chapter in the book. It turns out my wife was doing most of the snoring, and I was doing some of the snoring. And she's thin and petite, but she had a lot of sinus tract infections, was taking a lot of antibiotics. She was traveling a lot, and that was always tough for her allergies. Anyway, we both went in. I had an apnea of 12, which is mild sleep apnea. She had, again, she's 120 pounds, very fit. This was premenopausal. This was in our 40s. I say premenopausal because women have a tough time. In fact, most postmenopausal or menopausal symptoms are related to sleep because their snoring rate goes way up. But anyway, she had an apnea of, 34.5. Wow. So anyway, we went through the process of treating that, and that's why I understand both extremes. I had patients at 75, 85. When it gets knocked down, your life improves remarkably, even if you have mild sleep apnea. Mm-hmm. And again, the cutoff is at 5. If you have 5 apneas, that's anything over that, that's a problem. So,
and you're testing that with the sleep study?
Preferably, hopefully, a PSG, a polysomnography, which is a sleep study in a hospital setting or a lab.
Oh, in a hospital setting, not at home.
Not at home. I would be very careful with a home study. They tend to underreport. They're getting better. A lot of dentists will use what they call a PAT, a PAT. They're good for monitoring and titrating devices and monitoring to see if the therapies are helping that patient, CPAP, whatever.
But wouldn't it make it more difficult when you take them out of their environment and you put them in a hospital or a different? And
right.
Wouldn't that factor into it as well?
Okay, so this is a very common complaint or observation, and it's a good one. And I'm in a hotel and I'm not sleeping as well. It doesn't really matter. That's not what they're looking for. Okay. So your self-perception of sleep is typically, as a person, all of us, is wrong. We need the Oura ring. We need the stats. So a PSG is looking for brainwave patterns, which what was your delta wave sleep like last night? You wouldn't be able to tell me. Your Oura ring could tell me, but indirectly. Yeah. You'd have to infer from the patterns. And that's an interesting discussion if you want to have it. So really what they're looking for, you could have the worst night's sleep, and this is typically what happens. In fact, I would warn my patients. I had a form. I would say, okay, it's not going to be your best night's sleep. And a lot of my male patients would say, okay, I'll do it in a few months. Let me first, work on my sleep. And they would go to bed earlier and do all that. And then they would go in. They would say their sleep was better after 3 months, and they would go in. If I could still convince them to go in. And that first drop to deep sleep, and they would reach that deep sleep level, and then how long do you stay there for? Right? That's the question.
Of course.
They would pop right back out.
Yeah.
And then they would go back in. They would pop right back out. I don't care how well you think you slept or whether you slept only for 1 hour. I just want to see that one or first or second drop into deep sleep. And again, from the Oura Ring, you can tell how long those first bars are, those low deep sleep bars. That's a great sign. Now, if they're staccato-like and very short, that means your airway is collapsing when you get to REM sleep or deep sleep because your muscles are soft and they can't keep their shape and they're collapsing. That's what wakes you up. That's what keeps that bar very, very short. So that's the key. The PSG is measuring your brainwave patterns. It's verifying that apnea. The Oura Ring doesn't do that. It does it indirectly. And it does a pretty good job of it.
Yeah.
Because they compare it to the PSG.
And I'm looking at my Oura Ring here.
Okay.
I think it'd be cool to kind of review this because...
This is the kind of stuff that everyone should be talking about.
I agree.
This
is so important.
BMI, A1C, triglycerides. These are, I don't know if you saw Casey Means on the Bill Maher show.
You were telling me about it.
She nails it. I mean, these are things that we should be talking about all the time, that we should have numbers. Every year, everyone should have that. Also, blood pressure. I take my blood pressure every week, my wife and I.
I take mine all the time too.
Yeah. I just want to check in, make sure.
And it's $30 for a cuff on Amazon.
Yeah, exactly. And it's so easy to do.
So what I'm doing here, I'm just on my phone, not because I'm distracted, but I'm looking for...
We're all distracted, Ben.
Yeah,
Come on.
we are. I'm looking for a photo of my face back in 2018 because, and I was telling you offline, but for those watching and listening, in 2018, when I started seeing my functional dentist, biological dentist, after discovering the dangers of silver fillings and me having 8 of them, I explored biological dentistry and I found Dr. Theodore Herman here in Miami. And he did a 3D scan and everything, but he observed my mouth and he said that I had one of the highest arches he's ever seen. It was so narrow. It created a deviated septum, and you could see it in the face back then. So I'm going to get a photo of that. And then ever since then, I got the fillings removed safely, of course, but then he put me on this expansion device where I had it in my mouth as many hours as possible during the day where I was not speaking. And every couple of weeks, I would fine tune it to make it a little bit tighter. And I wore that for about 4.5 years, I was telling you. And then he said, you've done enough progress to put the Candid Pro, which is like an Invisalign. And I know you know this, but I'm sharing it for the audience.
No, it's good.
So I've been wearing the Candid Pro now for about 12 weeks. And I want you to look at my face back in 2018. And then I want you to look at me right now, how I look now. And then we'll put the photo on the screen for those who are on YouTube. And if you're listening on the podcast, you're going to have to go on YouTube to see it. But let me just grab a photo. I'm just scrolling here. But explain what I did, and then I'll find this photo as you're explaining the process of what I did.
So you did it as an adult, and that's more difficult to do. And we talked earlier about that distance of the skulls that I was seeing in our little museum. And then later in my career, seeing and remembering the measurement. And then noticing that all the measurements I was getting was less than that 200-year-old skull. Actually, it was 250 years old. And it was actually a Native American skull from the San Francisco Bay Area. I forget the name of the tribe. Yeah. But anyway, and so that width, it's the width of the upper jaw. And your face is only as wide as the width of the jaw, the lower face especially. But it can also translate into the upper face as well. And this whole part of the face is developing like crazy. It's growing downwards, forwards, width-wise. The width is typically the one that's most compromised, and then next would be the forward growth. And the skull is pretty much fixed, although that grows in volume as well. But this is most affected by the environment, by air pollution, by mouth breathing because you have allergies due to your environment, could be air pollution. Kids are very much affected by air pollution, especially in cities. And that affects their facial development, which leads later to like AFib because of sleep apnea. That's just one example. Could be breathing issues, could be a greater likelihood of getting pneumonia.
Behavioral issues as well.
Behavioral issues, ADHD, exactly. Very good point. So widening that before age 9, again, we talked about that, is very, very important because everything's very fluid and soft, and you're just trying to get that kid to their genetic potential, to where they should be, and undoing or going around all those.
Yeah. So I did it when I was like 30.
Right. Now that can be done as an adult.
So Cameron, we'll put this on the screen for those watching on YouTube, but here you go. This is the photo that he's looking at it, but you could see it on the screen here. That was me in 2019.
Okay. Well, the beard throws me off.
Yeah, the beard throws you off. I wasn't clean shaven back then. So
in fact, a lot of men subconsciously or consciously will do a beard or a goatee because they're deficient in the face. And I never wore a goatee until 10, 15 years ago, but I'm slightly deficient. I'm a class 2 in terms of facial development. Class 1 is ideal.
Yeah.
So it's slightly deficient here. And it was a conscious decision for me, but a lot of men look better in a beard.
Probably.
Exactly.
And now that it's better, I don't have the beard. But look at the top teeth. Like you can see.
Yeah, there's crowding.
Yeah, crowding. You can't see the bottom, but yeah.
I mean, one tooth flares out and the other one's flared back because it makes that space smaller. It allows it to fit.
So now look at me now compared to that. What do you see? What changes do you see with like my face here?
I mean, it's hard to say, but your nostrils have changed in the opening size of that. I don't know if that's true or not.
It has.
Okay. And that can happen with broadening. So when you broaden the vaulted arch, so when he said high arch, it was V-shaped, and you want the arch to be broadly shaped. And that brings down that little A-frame, which means the nasal septum will unravel, and then that changes the shape of your nose and the nasal passages. Not all the nasal passages, but the beginning ones. And so that's a big deal. That came to mind. Also, you're a little flatter here and a little more angular here.
Yeah.
And then profile, I can't tell because it's a frontal only.
Yeah.
So, I mean, and then your teeth, I can't really, they're more in place. And then your overbite, I can't tell because it's not showing here. But, I mean, it's hard to tell, but you've got a cone beam, right? You've got that 3D.
Correct.
And what you get the actual measurements of improvement in all axes.
So I haven't done a recent one. That'll be interesting.
That's what you got to do. That's very telling. In fact, you can see the size of the airway from a bony perspective, from a hard tissue perspective, but you can also get a measurement. The algorithms are fantastic.
That's what I'm going to do next time.
They can see the size of the airway in a relaxed position. They tell you what position to be in when they take the 3D cone beam. So do that. And but what have you noticed? I mean, can you is it easier to mouth tape? Do you sleep better? Have your Oura Ring scores changed?
Overall, I feel the best I've ever felt in my life. I just turned 40 and I just feel great. I used to nap a lot in the afternoon.
Right.
Rarely nap these days.
Yes.
Energy levels are great when I wake up. When I wake up in the morning, I feel well rested. Now, I still have sleep apnea because it's not completely fixed. It's getting there.
Yes.
The sleep is getting better, and that's where I want you to review, because I'm still waking up each night.
Right.
Now I'm getting about an hour and a half or so of deep in REM, but you can kind of see, and I'll put this on the screen too, Cameron, I'll send it to you, but this is last night, 8 hours and 13 minutes of sleep, and you could see the wake ups after the deep. That's kind of what you were explaining there. So you tell me what you're seeing. I know that it's not, I still have the apnea and it's a process, but it's better.
So this page, the one that you're going to be showing, is great. So your sleep score is good, but that's not everything. Your resting heart rate is good.
Yep.
Total amount of sleep is good, although that can be misleading.
Correct.
Some people sleep a long time because they're tired and they're a little groggy in the morning. And there's something called sleep inertia, where if you don't wake up, then you go back to sleep. We can talk about that later if you want.
Fix the mic, by the way, so it's closer.
Sorry. Thank you.
No worries.
So efficiency is not bad. It should be in 90%. Restfulness is good. You're getting a lot of REM and deep sleep, and that's good. Although that may be the Oura Ring misinterpreting that. And there's another product that I like that I don't represent, but I do want to talk about it. Your latency is 22 minutes. That's a little long, but it didn't show up as a red bar, although it can be too short. A lot of people think when they fall asleep in a minute or two that's great.
Yeah.
It's not good. You want it to be around 15 minutes, but Oura Ring is saying it's okay at 22 minutes, and that's not bad. And sleep is very individual. People sleep differently, and they have different environments. So this is the one that I always look at.
Yeah, the bars.
Yeah, the bars. And you can adjust the bars sometimes, which I wouldn't recommend, but sometimes latency is fooled because you're lying kind of slouching on a couch watching TV and it'll record that as latency, right? And you can adjust that. You can push that and then you know that.
Yeah.
Your movement scores are not good. And so it's the height of the bar and the frequency of the bar. And I rarely see those heights. So when you move a lot.
I'll shift complete to a different side, adjust the pillow between my legs.
Right. And it's often. And that may vary, from night to night.
It's happening every night.
Okay. And then 96%, 98's better. 96 is not bad.
For my oxygen saturation?
Exactly, right. But a lot of people are down in their low 80s, high 70s.
Yeah, that never happens unless I'm in Park City.
They're slowly dying.
If I'm in Park City, that happens.
Exactly right. That can happen in the beginning. In fact, going to high altitude does have an effect.
Yeah.
You definitely want a mouth tape. Open the window, cool down the room.
Yes.
Sleep on your side.
I want to talk about that.
Sleeping on your side?
Sleeping position.
Okay, that's important.
Let
me finish this. So lowest heart rate, you're in good shape. HRVs are low for a 40-year-old man.
Really?
Yep. Hang on. 99. Oh, sorry. The graph is relative. That's not bad.
Yeah, HRV
it's
is
nice
pretty
to
good.
see it really peak. So I'm around 80 to 90, and I'm 65.
That's good.
That is good.
Really
but
good.
I would look into HRV. It's good throughout the night. Again, back to this bar and the movement. There's something definitely waking you up, and it's probably your airway. And as you said, it's the sleep apnea. And have you gotten a sleep study?
I have not, because I know I have the sleep apnea.
Get it. Find out. Because when you, later in life, it gets worse. So you need a baseline. And then also, when you are fixing things, you want to know what's working, what's not. And getting that.
I was going to use the Orostats, but you're saying get an actual sleep study.
PSG is probably better.
Okay.
But it's expensive.
Yeah.
And that's the
it's worth it, though.
Yeah, it is worth it.
Yeah.
But it's $3,000.
Yeah, I think it's worth it.
Yeah, I do too. I mean, sleep is a pillar.
Yeah,
in
no,
health.
it's the foundation.
So this is good. I mean, there's so many people in this country that are way worse than this. But it's a great way to go. I mean, to measure like this every night, and we're not obsessed about it. But in the morning, we'll talk about our scores.
It's giving you data.
It's giving us data, and then it really has helped me do many things. And again, I know a lot about sleep. I've been trained in it. I've treated thousands of patients. But when it comes to your own sleep, it's kind of like, it's like, it doesn't apply to me, right?
Yeah.
It's that human male denial, reality distortion field, right? Which can be a good thing sometimes, right?
It works for you and against you.
If you're like a caveman and you wake up in the morning and you're thinking about that crudely made spear you made the night before after drinking a lot of fermented products, and you're going to go out with your buddies and take down a 6,000-pound mammoth, it's good to have a little bit of denial and
some ego.
Yeah.
So with sleep position, there's two thoughts out there. Of course, like my buddy Dr. Peter Martoni, who's a chiropractor, he'll tell you the best sleeping position is on your back with a pillow right behind your neck to restore the loss of the cervical curve.
Right.
Because all the problems that happen with that. But then you have people who say, look, if you have sleep apnea, you should not be laying on your back. It should be on your side. And I think you fall with the latter camp.
Well, so he's right. I mean, that is the best position for your musculoskeletal system and your back and cervical posture. And so the first step there, the first comment would be, most of our pillows are wrong. And, we're sleeping like this.
Yeah.
And that in itself puts pressure on this little floating bone, the hyoid bone. It can kink your airway, wrinkle it or wrinkle it. It also makes it difficult to swallow. It affects tongue position. And also, if you're on your back and you have a big tongue and your airway does collapse, the tongue will drop. And
that's pretty
bump
scary.
Bump up against the back of the airway. And that's why a mandibular device, which I wear, keeps my chin propped forward. And with the chin forward, the tongue's forward, it never bumps up against the back of the airway.
What is it called?
It's a mandibular advancement device. That's the generic term.
Okay.
So I wear one of those. I went from 12 interruptions to 0. My wife did too, by wearing this device. It's a MAD.
Do you have
mandibular
a
advancement
company?
Device.
A company? That
Well, the one that I wear, which is already 15 plus years old, they don't make it anymore. It was too expensive, but it was the most reliable. So I would just recommend seeing a American Academy of Dental Sleep Medicine.org trained dentist. There's a list. Also go to our directory. We have a directory of functional dentists. Most of them are trained in sleep apnea.
on AskTheDentist.com.
On AskTheDentist.com. And they will use a Medicare-approved device. I think the list back in my day was 21, 22 different devices. They're now being 3D printed. I'm not so fond of those. They don't last as long. But there are devices out there that will work well. And there are a host of them, just like the expansion devices.
Yeah.
And everyone's concerned about which device. It's the clinician that determines the efficacy and the therapeutic benefit.
Makes sense.
Yeah, right, right.
So back to the conversation with sleep. If you have apnea on your side, is going to be better for you.
So the tongue position is not as crucial. The weight of the tongue. Side sleeping can be difficult for shoulders, for the neck position. You need a thicker pillow. Then if you roll over a lot, then you need a multi-thickness pillow. I have my favorite pillow. I just found it, but every few years I find a new one. I side sleep typically. When I start off side sleeping, and that first bar that we talked about, that first drop is long. I mean, it's double of what you have. But then if I don't side sleep, it shortens. It becomes more staccato, and I get down to that zone.
Interesting.
But the airway brings me back out. It collapses. So you really have to fine tune your situation, your bedroom environment, your sleeping position, the firmness of your mattress. I prefer a firmer foam mattress, but I think foam is better for side sleepers because you don't have the shoulder and hip problems. A coil-over mattress kind of bends you. And the chiropractor's right. Sleeping on your back is the best position if you're healthy, if you're a caveman.
Yeah, that's it.
Right? But if you're sleeping on your back or sleeping on your side, make sure your spine is straight. Cervical spine is very important. When you do airway resuscitation, CPR, the first thing they do is adjust the position, because they know that helps the airway. It's the same thing at night, but
Makes
it's for
sense.
7 hours.
Yeah.
Right.
Let's get into root canals. What's the problem, the dangers of root canal, and how does it affect chronic disease and our lifespan?
That's a very controversial question.
It is.
Dentistry, just in general, we're great clinicians. We've done amazing things with teeth. We're good at fixing things, very small things that are hard to get to in the mouth. We've done a great job of that. We haven't done a good job on the science end of things. In fact, we got kicked out of the club. Medicine and dentistry were part of the same professional organizations, and I think we got kicked out in 1839. It was a big argument, and they thought we were charlatans, and even though when they needed a root canal or an extraction, they would come see us. We invented local anesthesia before they did. Anyway, interesting story. But so here we thought, okay, so there's a hard-shelled tooth. It's not an organ. It's the only part of the body that is that way, where it has a blood supply to it. It has mesenchymal tissue in it. That's the tissue that helped form the tooth. It's like an embryonic tissue. It has neurons in it. It has a nervous supply, so it can sense the world. I have a theory out there that teeth act as accelerometers. We can talk about that later. It's a little out there, and that's why crowded teeth are bad for many reasons. But there's a lot of stuff. There's a lot of living stuff that goes on inside of a tooth. Now, if you have a cavity that reaches that, it will infect it and kill it. That's where you get that incredible tooth pain. It's inflammation in a closed space. Where else in the body, other than a joint, would you get a vascular tissue that when it swells, it has room to grow, right? Well, there's no room. So it cuts off its own blood supply. It's creating then that necroses and dies. It becomes very toxic. It's dead tissue. The nervous tissue, for as long as it's alive, gives you a lot of kind of osseous pain. That's bone pain, similar to bone pain. It's the most painful. It's like compound fracture, breaking a bone. So it's a lot of pain, and it's kind of near your control center. Eyes, mouth, nose, smelling. It's not the distance to the brain. That has nothing to do with it, but it's a big deal. Tooth pain has shaped world history, clearly. So dentists, back I think in 2,000 years before Christ, BC, the Egyptians were doing root canals. They discovered that they had cavities back then because they were eating a lot of grain, the Egyptians, they would figure out a way of getting inside the tooth. I don't know how they did that without anesthesia. I don't want to go there.
Oh my gosh.
And they would pull out this tissue. They also did it when they mummified the body for burial. They would take out all the living tissue because that was, otherwise it would be a mess, right? There'd be maggots and, we won't go there. So anyway, that worked pretty well, and it got better and better, and we're still improving that method. We're taking out that dead tissue, and sometimes the tissue gets taken out too soon. That's a different story. Dentists jump on the root canal thing because it's paid for by insurance at 80%, and a root canal will cost $1,200 to $2,000. It's a very technique-sensitive thing to do. Not everyone should be doing root canals. It should be someone who's very skilled. They go in there, they clean everything out, and then they fill it and seal it. And theoretically, if you can seal that tooth perfectly, since it's an inanimate object and it's being held in place by little fibers, periodontal fibers, that would do the trick and would be fine. Here's the problem. It's impossible to seal that tooth completely. We look at 4 or 5 canals per tooth. Some teeth are simpler or easier to fill than others. Some are straight shots. Some have tortuous canals. And for example, the upper first molar, upper second molar, 20, 30, 50 canals that never get filled. Very small canals that run perpendicular to the main canal.
Wow.
And eventually, so if the root canal is well done and there's some side seal and pressure from the inside and it's pushed out, the tooth will be fine for a while until it starts leaking, until the bacteria start acting up, and then the immune system responds. I hope this is not a too long-winded definition.
No, it's
I'm just
great.
trying to keep it very simple.
No, go deep. This is important.
Then obviously the body goes danger, Will Robinson, right? There's a 3-alarm fire there of inflammation, and it's not going anywhere. The body can't heal it. There's no blood flow. You know, if it was out here, it would necrose and fall off, right?
Yep.
And then it becomes a problem. Then the bacteria becomes so virulent that you get sepsis. It's essentially a steady, slow state of sepsis.
Wow.
It can be abrupt. It can take you down. It can kill you. Happened when we started getting good records in the late 1500s. A lot of people were dropping dead after a few years of a fistula or a swollen face. You know, odontogenic infection.
Wow.
So it can take you down. It's one of the most likely emergency room admissions is a toothache, and physicians don't know what to do. They give you an antibiotic, and that bacteria changes and morphs a little bit, becomes more virulent, and it's that adds to the bacteria that we're dealing with in general. There's resistance, and then the tooth gets taken out, right? Or sometimes even worse, it gets retreated. Retreating a root canal.
Oh.
It's only a 50% success rate. Modern dentistry will tell you there's a 97% success rate of doing a root canal. What is success? Well, success to them is patients out of pain, the swelling goes down. It's a miracle.
They didn't die.
And they didn't die. It's a miracle, right? So, and that's fine. And in some cases, that's the way to go because you don't want to jump right into an implant. But then it has to be monitored. And then you need a cone beam x-ray. We didn't have cone beam x-rays when I started practicing. And so I would tap on these teeth, root canal teeth, I would tap on them. If they were sensitive, that meant there was some inflammation with that PDL, that periodontal ligament, and there was leakage. And that was a dangerous sign. You could look at the x-ray, but it was only two-dimensional. You could get fooled by that. So a lot of teeth were left in place that shouldn't have been, and then they start seeding the rest of the body. And you start getting infections. You can get rheumatoid arthritis. You can get cancer. You can infection of the brain. You can get sepsis. You can die. Fever. All sorts of things can go wrong from there. So root canals are not the miracle we thought they were. They still should be done as a temporary thing, even for a few years. The implants are getting better. They're not perfect. Titanium implants are not perfect. They have issues. There is reactivity to it. The zirconia, ceramic implants are better, but they're not as good as a natural tooth. So you really don't want a root canal. You want to prevent that from happening. Don't ever let decay get so bad. Start off with a good diet. I mean, and I know that's very unreasonable of me to say, right? I mean, let's say you're a kid, a teenager. Your parents don't care, or you're an orphan and you're on the streets and you're eating Cheetos. And I mean, you're going to have a lot of extractions because you probably won't be able to afford the root canal. So root canals are problematic. I think there is a group of dentists out there that have really maligned them and created a lot of fear with patients. A lot of people are doing very well with root canals. They have no changes with their systemic measurements and stats, CRP, A1C, and all of that. It's kind of like breast implants. Some women do well with breast implants, but when they go wrong, it's a real problem. It's how your body reacts. How healthy are you? So
I think that's it. How full is your stress bucket?
Right, exactly. And we're all exposed to toxins. I would say, get rid of all this stuff that we do in dentistry. Prevent it. Don't do it. Get rid of fluoride. These are all things that diet, inflammation, mercury fillings. You know, try not to do as much of that as you can. But I don't want to scare people. I don't want to be unreasonable. And not having teeth is a problem as well.
Yeah.
People that have fewer teeth, even if they have implants, they don't seem to live as long as people that do end up with all their teeth. So I don't want to scare people. You know, the same thing with cavitations, and dentistry is expensive. And the dental insurance product is terrible. I mean, it's not insurance. It's more of a benefit if you have it, and not everyone has it. So,
if you're following a low carbohydrate keto diet or carnivore diet, this is one of the most important tips. I see a lot of people who struggle with keto and carnivore, and the reason they struggle is because they are losing too many electrolytes. They're becoming mineral depleted. Every cell in your body needs minerals to function, to produce energy, which helps you burn fat and feel good. My favorite minerals and electrolytes are from Beam Minerals. These are fulvic and humic compounds that are bioavailable, that have over 70 minerals in them. It tastes like water. They're carnivore friendly. Let me explain why. There are no anti-nutrients in them. It does not break a fast. As a matter of fact, it could support your fasting window, and it's been a game changer for my health, and I recommend it to all my students. Head over to beamminerals.com. Use the coupon code Azadi at checkout, my last name, Azadi at checkout, to get a nice discount. Beamminerals.com, coupon code is Azadi.
When I interviewed Dr. David Minkoff, he said something that could be perceived as scaring people, and you might disagree, and I want to get your thoughts. Dr. Minkoff, do you know Dr. Minkoff?
I do.
Yeah. He said that 100% of root canals are infected. Do you agree or disagree?
It's the terminology or the semantics of it, I think.
Okay.
I mean, there are a lot of infections in the body that we don't know about. You probably have an infection somewhere in your body right now. It's likely. It's probably a very small infection. It's probably very transient. Every time you brush your teeth, you get a little bacteremia. Every time you go see a dentist and they scrape your teeth and there's some bleeding, you get a pretty solid bacteremia for 20 minutes. That's an infection of the blood. Your body's always fighting infections. They're always there. They're constant. You can breathe in a toxin. There's an inflammatory response to that. It's not an infection from bacteria, but it is an inflammatory response. That goes back to the nature of what is a sealed root canal. And I think I said it well.
You explained it well.
10 minutes ago. It's not perfectly sealed. There's some canals, especially those accessory canals, that are not sealed. The gray areas are like, what actually works for what period of time? And I think these dentists would get so upset at me for saying that. But let's be practical, right? Same thing with cavitations. A lot of people are flying to Germany to get cavitation surgeries done for tens of thousands of dollars in one visit, and they're hoping that some major disease that they're suffering from, some chronic disease, goes away. In some cases it can. But cavitations are not. There are some dentists that say that every tooth that is extracted will become or is a cavitation. There's no data that supports that. Now we have 3D scanning. We do biopsies. I know a lot of dentists that are research-orientated or have read the research and that are in the trenches doing a lot of extractions and implants. Every time you go in to do an implant, you're looking at a extraction site, and you're making an assumption. You're recording some data clinically. You're looking at that and going, well, there is some necrosis there. That was a cavitation. Let me clean it out first because my implant won't do well. I want it to do well for my patient. I'm not going to put a bone graft in there until it's all clean. So are there dentists out there across the U.S. saying, all of them are saying 100% of the time there's a cavitation every time they place an implant or take a look at that area? No, it's not true. So a lot of people are getting scared into a lot of unnecessary dentistry. Now, I'm not saying that cavitations are a scam or that it's not true.
I get that.
That's all part of the dark side of dentistry that we haven't really, and there is a proper way of taking out a tooth. And then there's an improper way. It's a problem. So, and it's like anything else. I mean, whether it's a pilot or a podcaster, not all of us are at the top of our game. That's just reality. We just don't have the education or the will or the knowledge or the time or whatever. I mean, so it's really who you pick and who your clinician is.
That's fair. It makes sense to me.
Right. But that statement is not incorrect, but I just wanted to qualify it.
I get it.
Yeah.
With the items we have in our bathroom that we use for dental products, let's just unpack a few of them that are good, that are bad.
Right.
Antiseptic mouthwash.
Right.
Good or bad?
Oh, it's bad.
Yeah.
Absolutely. I mean, I hope everyone knows that by now. I mean, why would you want
They
to
don't, because I posted reels and it goes viral of people not knowing this.
So there was a study in 2005. I think there may have been an earlier one. We mentioned that on our Instagram. We talk about it a lot. It's come back up because now it's tied into nitric oxide production. Oral microbiome is now on center stage, which is wonderful. That is the basis for everything that can go right or wrong in dentistry and systemic health in many ways. 99% of mouthwashes are based on, I don't even want to use the word technology, but not even science, but it's the old soap manufacturers. Basically selling snake oil salesmen, selling stuff out of the back of their wagon, covered wagon, and it's essential oils, bactericidals, things that smell good and that disinfect the mouth. Listerine was based on eucalyptus oil, which is the worst essential oil you can use in the mouth. It's the strongest one. Cinnamon is next, and then I think anise is on the bottom. I mean, there's a whole range. There are studies on the bactericidal effect and activity of essential oils at different concentrations. You don't need botanicals in your toothpaste. Don't do it. Keep it simple. That alters the oral microbiome. But mouthwash does too, and mouthwash is the big one because you're swishing with it twice a day. About 2/3 of the nation here in the U.S. uses mouthwash twice a day. About 2/3 has high blood pressure issues.
Yeah.
You know, is that
coincidence?
Is that coincidence? I mean, there's probably a lot of overlap and all that, but we have studies where people's borderline cases where people stop using mouthwash within 6 weeks, sometimes less. The blood pressure drops to normal levels. We also have studies on the other side of the coin that you can take away the mouthwash or not. You can start tongue scraping, and you can lower your blood pressure by doing that because that increases the nitric oxide production because you're affecting. You're stimulating the bacteria. Stimulating is not the right word. You're aiding the bacteria on the back of your tongue that help produce or break down nitrates to nitrites to NOx to NO3.
So you're a fan of tongue scraping?
Big time.
I do it every night and in the morning. So stainless steel?
Doesn't matter. Stainless steel. I mean, plastic works, but let's not use plastic.
Yeah.
Copper has no benefit, but if you want to use copper, it's fine. But we sell a stainless steel tongue scraper on our toothpaste site. I mean, it works and it lasts forever, and it's such a lot of people are grossed out. There are people that gag. Those are people that have sleep apnea, tongue tie, or mouth breathing. Mouth breathers are, by the way, just as an aside, mouth breathers are my worst patients. Not in a mean way. They're just phobic because I'm blocking their main airway. They're not able to breathe through their nose.
Yeah,
I mean, right? Okay. So especially with kids. So that's something a dentist has to identify right away.
Should you do tongue scraping after brushing or before? It doesn't matter.
It's a good question. I wouldn't sweat the details on that one. I would with brushing and flossing. We can talk about that if you want. But tongue scraping, I would tongue scrape first thing in the morning.
Before you even brush, before you do anything?
Because that's when that tongue is coated. You've had a dry mouth, low saliva flow, even if you've mouth taped. Hasn't been a lot of movement. You want to get that nitric oxide going right away. Tongue scrape first thing.
How long are you doing it for? Tongue scraping?
I do it. So that's a great question. In the beginning, you're going to do it a lot, and you'll see why. So keep tongue scraping until that
film is no longer there.
It's a beige kind of colored fluid. It is 99% of the time. It can be blood tinged. That's possible, and that's not bad. It's not a cut of the tongue. It's inflammation. It's like bleeding gums. Keep scraping until that's all gone, and you don't see that beige fluid or the blood tinged beige fluid anymore. So in the beginning, that could be 5 minutes, and break it up into sessions, right? Don't overdo it. And you can't overdo tongue scraping in the beginning because your tongue's not used to it.
Yeah.
It's covered by this thick film and it's dysbiotic and it can't release those or let those bacteria do their job because it's covered in this thick kind of polysaccharide layer of just junk and crud and debris, food debris, plaque. I won't go beyond that. I mean, we find all sorts of things in between all the little papillae of the tongue.
Sure you
debris,
do.
microplastics. I have found microbeads
from
on the
floss
tongue
and
from toothpaste. All the big toothpaste manufacturers in California, at least, were making toothpaste with little microbeads in it. Not microplastic. It's larger. You can see it with the naked eye. But we have loops on, and we were starting to see this inside the gum, and there's an inflammatory reaction, a foreign body reaction, and they outlawed it finally. They said no more microbeads. It was just to make the toothpaste look appealing.
yeah.
Little flecks of plastic that were brightly colored. Oh my God! You find that in the tongue. That's like almost like a root canal.
That's crazy.
Underneath the gum tissue.
Wow.
It's like popcorn. It's like a popcorn hull that gets in there. It's a foreign body reaction, and the body lets you know right away. Inflammation, pain, soreness, positional pain. When you move, you can feel it.
What a
blood
disaster.
is just pulsing to that area, right?
So no antiseptic mouthwash. We don't even need mouthwash if we're eating a clean diet.
You don't. It doesn't work.
Yeah.
It actually makes it worse.
Even essential oil mouthwash here
Absolutely, stay away.
because
the
of what it does.
holistic, homeopathic
So
ones.
no mouthwash.
No mouthwash. Tongue scraping.
Tongue scraping is good.
Yep. That's your mouthwash.
That's your mouthwash,
That's your
tongue
mouthwash,
scraping.
right.
And then with toothpaste, we're staying away from fluoride toothpaste. What are some of the red flags in toothpaste you want to be aware of and stay away from?
Other than fluoride?
Fluoride, explain why we want to avoid that, but then other than fluoride as well.
I mean, it would take 2 hours to...
Yeah.
But the good news is that there was a federal lawsuit after 7 years, successfully won a case against the EPA. It's the tipping point. Of course, we have RFK now saying...
Want to get out of tap water.
Yeah, to get it out of tap water. That's kind of brought it back, that whole fluoride controversy, into a conspiracy theory again. I'm not against what he wants to do in that regard, but it just his speaking about it in that way has kind of harmed that whole movement of getting fluoride out. That was 7 years of research and data and expert witnesses and incredible research showing and demonstrating by correlation that there's a lot of damage to a developing brain. IQ drops, and there are other things too. We've known for a long time that fluoride in the water does not work. Cochrane Institute, they do great systemic
Cochrane
reviews.
collaboration,
exactly. They just came out with their overview of the whole thing. There is a 4% likelihood that fluoride in water could help. 4%. There is almost a likely certainty that fluoride in the water will harm the brain of your child, even fetus.
So the cons outweigh the pros any day here.
Let's fix the tooth, but we can't fix the brain. I mean, it's ridiculous. But dentists are digging in their heels. The ADA is digging in their heels. So,
of course they are.
So I'm hoping that our Robert Kennedy can just shut it down. But the good news is that before he came on the scene, after this verdict, which came in August, I was literally in tears when I heard that. My whole life I've been against fluoride, adult life, even before I was a dentist. It just didn't make sense. We had less data then. We have a lot of data now. But even before then, before Kennedy came on the scene, municipal water supplies are shutting down. They're saying, we don't want to do it anymore. Because now we have that legitimacy of that federal ruling against the EPA. And it costs cities money to do it. And sometimes they put in too much and too little, and that affects teeth. That can harm the teeth, can cause more cavities. It can cause other issues, thyroid issues. I mean, it's a 2-hour episode.
Yeah, so just stay away from it.
Stay away
Bottom
from it.
line.
Yeah, and even in toothpaste, because it does get absorbed through you. So the biggest problem now is going to the dentist. Up until age 14 in the U.S., you get this fluoride treatment. That's 24,000 parts per million of fluoride. One hit for 3 minutes. That goes right to the brain within 10 minutes. That is unacceptable.
Wow.
Stay away from it. FIG has developed a product to replace that little tube. Products are coming. Codes are coming for it. So dental codes are coming for it. ADA and all the big dental organizations are seeing the writing on the wall. The fluoride treatment is a big moneymaker for dentists. Most dentists can...
That's why they're fighting it.
That's why they're fighting it. But there are alternatives coming, and this is the first
vanilla vibes.
Yeah, non-fluoride. We have a mint flavor, but it's the first of commercially available. I don't even know if there's a non-commercially available product like this, but it's a very strong nanohydroxyapatite, which is the material in your tooth, version of a varnish without all the chemicals in varnish. Varnish has crazy stuff in there, like resins and glues, because they want that to stick on there for 3 to 4 minutes. But then it doesn't have the 24,000 parts per million of fluoride, which is really damaging. Toothpaste is 0.7 to 1.4.
Wow, that's
and the water
crazy.
has been dropped to half of what it was back in the 90s and early 2000s. So I'm so glad that's getting out of your system. But to move on, there are other things in toothpaste.
Yeah, what
essential
else?
Oils.
Essential oils. You said
Don't do essential oils. You don't need them. And some of these toothpastes, even the homeopathic ones from Germany, it's like makeup and cosmetics. You see a list of different leaves, and I mean, all of that is a waste of time. And there's probably not enough in there to even be concerned about. Why even put it in there? It's a waste of time. You just need a remineralizing agent. You need xylitol. These are all good things, just thickeners, and to make it a paste and to deliver a remineralizing agent. You can put a prebiotic in there, not a probiotic, but a prebiotic would work well in a toothpaste because that helps feed the good guys, right? The
Makes
bacteria,
sense.
the oral microbiome, because it's the oral microbiome that helps remineralize and protect your teeth. It does other things too, gums and everything. But you got to support the oral microbiome. You have to nourish it. The oral microbiome should come first. 99% of the toothpastes out there are doing the exact opposite.
It's crazy.
They're taking down the oral microbiome and disinfecting your mouth.
Yeah, that's wild.
It is wild. And toothpaste could potentially, and I'm just waiting for some research, could be adding to insulin sensitivity, blood pressure issues, inflammation, because the oral microbiome, we're finding out now, is so connected to everything else.
Makes sense to me.
Metabolic syndrome. There is now a connection between poor oral hygiene and metabolic syndrome.
I believe it.
Yep. Tokyo study, 2020. And enough. Let's just get on the bandwagon here and start protecting this oral microbiome because it's linked to the gut microbiome. That study demonstrates a P. gingivalis bug in a dysbiotic mouth that gets to the gut. It alters the gut and also skeletal muscle, and therefore has an effect on insulin resistance. I mean, how bad do you want to use a toothpaste that smells good with essential oils in it? And
or mouthwash.
I mean, we've had triclosan in our toothpaste. That was banned finally. Antibacterial soaps. We've had pesticides in our toothpaste. We've had all sorts of crazy things. Again, that model should be broken by now. We don't disinfect the mouth. It's not a dirty place.
I agree with you. Yep. And you created your toothpaste here. Feed Your Good Guys, FYGG. AskTheDentist.com if you want to see some of the products that you have. I'm gonna be trying these. I'm going to try this tonight, starting tonight. With floss, Mark.
Oh.
What are the pros and cons? You mentioned there's a right way to do it, brushing and flossing. Which one happens first, and what should we be looking for when we're buying our floss?
Yeah. So obviously, first thing, and I've complained about this for a long time. It was even before microplastics were used as a term. It was nylon. I just didn't like nylon. Pieces of nylon were breaking off. I actually verified that through a scanning electron microscope.
Really?
In the Silicon Valley, I had a friend who worked at Agilent, and we were looking at floss back in late 1990s. And floss, when you use it, I would floss it on a typodont, which is kind of fake teeth, and I would floss that whole typodont, and then we would zoom in on that, and you see little pieces of nylon in your mouth. Where does that go? I don't know.
Who knows?
Anyway, and then the microbead thing came and everything. But now it's microplastics, and it's also Teflon. PFAS in the slippery glide makes it now. It was made by Gore-Tex. We thought that was a brilliant invention because it's difficult to floss. Most people don't floss properly. It's very difficult to floss. Even as a dentist, even as a hygienist, it is not an easy thing to do, especially as children. The elderly, the handicapped. We're asking people and then shaming them when they can't floss. It's the most difficult thing to do. But you can. I'm a big fan of floss sticks. I was promoting floss sticks made by Listerine. Listerine bought out the company. It was made by Reach, which was a 3M company at first. But anyway.
So what's a good brand for floss sticks?
So I use Slate electric flosser.
Slate electric
flosser. SLATE. That has fixed the problem. It vibrates. It gets the floss in between the teeth. It's easy to use. You don't have to put your fingers in your mouth. You don't have to wrap floss around your fingers. And then it has these crazy, again, I have no affiliation with the company other than I've done an ad for them just because I love them. I turn away and you have no idea how many people I turn away. I get 3 to 10 offers a day of, could you just talk about, or we'll pay you to talk about our product. So There are a few that I like. Slate is one of them. So
I haven't heard of them. Now I'm going to check them out.
So look at the tissue guides, the little gum guides. Those are little silicone triangular pieces between the two sides of the floss. We've got a video coming out on how to apply varnish to those little triangular guides, because there are little hairs on those guides that would hold the varnish. And that is like a little snow shovel or like a little triangular. It's reverse engineered. It's the shape of the embrasure, the area, the triangular area below the tooth.
That's
there
it, huh?
Yep, that's it. And it literally scoops out plaque that floss wouldn't normally get. It's brilliant. It's patented. The dentist that
I'm gonna buy it. Now let me ask you this: the one I've been using, and you could tell me if this one is bad or not. Organic dental floss stick, strong bamboo, charcoal thread.
Charcoal's not. I mean, stay away. It's not
so
bad.
This is not the best floss. I've been using this one. No. Okay, I'm getting the Slate one.
So back to the microplastics, I recommend Radius Floss. All these items are on our store on Ask the Dentist. Radius Floss is
AskTheDentist.com. You could find everything we're talking about.
It's an East Coast company, female owned, up in Massachusetts, I think, maybe Maine. Radius. Wonderful. I use their toothbrush if I use a manual toothbrush, recycled handles, and their floss is 100% silk.
Okay.
And, I mean, that's natural product. But stop using nylon floss. Stop using Teflon floss. Get rid of it.
For sure, stop doing that.
We have enough of a load. What is it? We get a credit card.
Yeah, 5 grams a week.
5 grams
credit card a week of plastic.
That's an easy one to prevent from building to that load.
Yeah, definitely don't want to do that. They're finding microplastics and
crazy.
That's
our next big problem.
Huge.
Testicles,
plastic generation right
reproductive organs, sperm counts going down.
It's crazy.
It's a hormone disruptor.
Yeah,
and it's everywhere. And we
Tupperware, plastic cutting boards. You want to avoid that. I mean,
or even a wood cutting board.
Even this, even Fiji is good water, so this is better. The glass, right? I tend to use this most of the time.
Cutting boards. I mean,
the plastic.
They glue even wood cutting boards. They glue the pieces of wood together. That glue, you're chipping away at it while you're cutting,
even if it's wood.
Right. Yeah. You need a solid piece of wood. Yeah.
So the plastic cutting boards are not good. The wooden cutting boards are better.
But if they're solid.
But you got to make sure it's solid.
Yeah. No glue.
Wow, we unpacked a lot. A couple things here as we land the plane, then we're going to go get some steak together.
Oh, there we go.
Eat some organ meat here in Miami. Let's
go. Bone marrow, maybe?
I don't know if they have bone marrow, but they have organ meat. They have sweetbreads, and they have like grass-fed burgers.
Nice.
I don't know if they have bone marrow. I
had a grass-fed Wagyu burger here in Miami 2 nights ago. It was incredible. And we had a little bone marrow last night. And that
I
was
love
incredible.
me some bone marrow.
Yep.
Well, I just finished up a new book, Mark. It's coming out in May of 2025 with Hay House. It's called Metabolic Freedom. It's all about the metabolism. And the concept is that we're designed to have metabolic flexibility. We know Mark Sisson, right? He talks best at speaking about metabolic flexibility. Unfortunately, 93% of Americans do not have that. They're metabolically handcuffed.
Yes.
And that's a big problem, right?
It is.
So what would you say are your 3 top ways, and this will be like kind of like rapid fire, your 3 top ways to achieve metabolic freedom?
Right. Look at your mouth. Chances are, very high likelihood, that you're not able to achieve that only because of your mouth. You may be doing everything else right, and there's something in your mouth that's holding you back. It could be the way you floss. It could be not flossing. It could be mouth breathing. It could be the toothpaste you're using, mouthwash you're using. Look at your mouth and never stop looking.
It's good.
The mouth is huge. It's amazing. We just barely touched on it. There are bacteria in the mouth are showing up everywhere in Alzheimer's, cancers, prostates. It's frightening. We've ignored it way too long.
Well, you're doing a great job getting the message out.
Thank you.
All right, that's number 1. 2 more.
2 more.
Yeah.
On
achieving metabolic flexibility, metabolic freedom.
Oh boy. I mean, obviously diet, lifestyle. I mean, I would go a little higher level than that. Most of us, I mean, the knowledge that you have, the knowledge that I have, I mean, this has been a hobby for me since I was a teenager. I read books on longevity when I was 17. I mean,
that's cool.
Talk about nerding out, right? Anyway, and then I was a biochemistry major. And so it's easy to talk about lifestyle changes and diet and which diet. And I think if you do have gum disease, you should definitely go keto or carnivore.
Yes.
Until it's gone. I do think that's kind of low level. But I would find whatever condition you have, and most of us are not metabolically doing very well, I would find an influencer. I didn't say physician or dentist, although hopefully it's one and the same, right? That would be nice. That really knows what they're talking about. That if you listen to every day, just on a podcast while you're driving or hiking or walking or jogging or cold plunging, whatever, eating, lock into that. A lot of us don't do that. It's the same thing in the financial world. A lot of us are not financially very smart, and we don't make good good calls and where we put our money, and that hurts us over time. And this is a cumulative effect. And do that as early as you can. So find someone so if it's a dental issue, follow someone that can give you the right advice, or maybe just seek out a professional that when you see them, we have that directory on our website of functional dentists. I think the functional way is the way to go in dentistry. There's no better way.
I agree.
You want to see the big picture. You want to, when you come in with gum disease, you want your dentist to find out, what's your insulin like? What are the numbers on that?
CRP.
All
A1C.
A1C, exactly. So I think that would be a big one. That's an easy one to do. Just make that commitment. Have someone else do the work for you. The good news is that a lot of the time that's free, right? I mean, unless you're seeing a dentist, but try and educate yourself, because you're not going to get it from your healthcare provider.
Not right now. Hopefully that changes. That's great advice.
Yeah,
You're absolutely correct.
Third one. Oh my God.
Third one. Would it be early time restricted feeding? We had chatted about that before.
We did talk about that.
Yeah.
If you have gum disease, don't skip breakfast. There's a study out now from the Journal of Periodontology, very, very reputable journal on that. That's a very interesting study. There's some talk about, especially for women, how it's not good to skip breakfast. But I would skip dinner. I would do some intermittent fasting and skip dinner. But if you go keto or paleo or carnivore, and I'm not saying do it forever, but that will solve a lot of that. You don't even have to, intermittent fasting will come on its own.
It'll be a byproduct.
Because your appetite is less. You're going to go from 3 meals with snacks in between each meal to I'm not that hungry. I don't feel like it. I'm not in the habit of doing that anymore. And I'm losing weight, and I'm liking how I feel, and I feel better, and I'm able to put on more muscle mass and all of that. That will all fall into place. So I think it's crucial to find the things that will change your behavior. Find those things and let everything else fall into place. And that could be finding the right influencer. It could be intermittent fasting. I don't know. I think I'm trying to find a third thing here for you. I think we talked about it. This is more low level. I would radically change your oral care regimen. I would throw everything away you've got at home. The toothpaste, the
mouthwash.
And maybe not replace it for a while. Just floss and brush. I would use a slate flosser, and I would use an electric toothbrush like a Sonicare. If you're worried about staining and you're younger, under age 40, maybe an Oral-B, because that's a different technology. That's a oscillating head. It's good for staining, and thick biofilms. It's good for mouth breathers because it's more aggressive. As you get older and you get more spaces between your gums with gum recession, a Sonicare tends to work better. So maybe just do the mechanics of it first and take away those products. And most people notice a change right away. Their breath gets better. The taste in their mouth is better. They're not reaching for all these products that smell and have perfumes and botanicals in it. So exercise, sleep and exercise.
Foundations.
Foundations. I mean, one of my favorite tips, and it's helped me, is set an alarm to go to bed. Go to bed within minutes of the same time.
Yeah.
That habit alone, you'll be waking up at the same time in the morning, because that's how the circadian rhythm works.
That's right.
Unless you're flying a lot and traveling, that kind of does mess it up. Get deep sleep, fix your sleep if it's not, and verify it. Verify it weekly, monthly, daily. I write about that in my book, verifying the ability to sleep properly. It's not guaranteed, not by any means. And then exercise. God, I worked out this morning in the hotel. It was kind of a difficult thing to do. I had to find it, and it wasn't the right weight set. But I got down and did rowing, and then I did a pull down and modified it by getting on my knees on a mat, and that really makes you feel better. That fixes a lot of things, especially up here.
Oh yeah.
Yep.
Yeah, that's great. Those are great tips. So askthedentist.com is the website. at Ask the Dentist on Instagram. You're also on YouTube. We'll put all the social media channels down below, of course. The final thing I always ask all my guests is about gratitude, which I call vitamin G, the ultimate supplement in the world, right?
Yes.
What do you have gratitude vitamin G for today, Mark?
Today or last week or
at this moment?
In general, right? Oh boy. My health. Although it hasn't come easily. I mean, but knowing what to do and being that 17-year-old nerd and worrying about it back then, that's been a big help. Addressing my health issues, not always in a timely way, but I'm just happy for my mental health. I'm 65. I'm able to do. I'm very grateful for my profession. I know I speak poorly of it sometimes, but that has been wonderful because it, along with that and the curiosity that I had as a 17-year-old, and then being a dentist, and then transitioning to the bigger picture, that's helped me overall in so many different ways. Obviously, I'm very grateful for my family and friends and relationships, and I have so much support. I've got great daughters, 3 daughters. All the dogs I've had have been extraordinary. I think most importantly, though, is having a voice. Is people trust me. I'm not trying to brag in any way, but I saw that in the beginning of my career. I would talk to people and they would say, okay, what do I do now? And so I'm very grateful for that. I take that very seriously. I never want to take a misstep in that area. So having a voice, I get very frustrated about things like mouthwash and fluoride but having the voice and being able to talk to you and on podcasts and TV shows and in films and all that I'm very, very grateful for, to be able to have people listen and at least get a kind of an alternative view on things, especially in health.
If you enjoyed that conversation, you're gonna love the recent conversation I had with the mineral master, Caroline Allen, and the mitochondria and how it uses minerals to produce energy and burn fat and feel good.
There are 4 main reasons that we are dealing with mineral deficiency. The first is that our food supply is lacking in minerals. And